we have this kind of number in our heads that 15% of Parkinson's cases are genetic and 85% fall under this environmental umbrella. So given that so many Parkinson's cases are considered to have environmental causes, can you jump into what we know about the environment and how that influences Parkinson's?
Sure. So I might have just a small correction first, because it's important to kind of frame it. So you mentioned that maybe 15 or 20% are thought to have genetic risk factors. Even those likely have some mediating effect of our environment, of our lifestyle. The greatest risk factor for Parkinson's is not genetics, it's age. So age is the biggest risk factor, and it faces all of us. The environment is an interesting piece of it, because the environment, is just a nice way of saying exposures, many exposures throughout our life. So those might be drugs that we've taken in our lifetime. Those might be pesticides or chemicals that we've been exposed to. They might be the food we eat. So all of these things come together into that genetic picture. So most Parkinson's cases statistically are what's called idiopathic, which just means without known cause. So some of that is likely environmental, some of that is likely unexplored or poorly understood genetics, and other pieces may just have to do, again, with the random mediating effects of age and things like that. So there's a lot of things coming together. So I know that doesn't answer your question. I'll get back to it. But so when we think about the environment, again, we're really trying to dial in on which pieces of your lifestyle are most significant to disease and disease risk. So we want to understand, if you've grown up in this area of the country, you might be exposed to agricultural chemicals. If you had experience in military service, you might have been exposed to industrial solvents or things like that. If you've worked in a factory, the same. And so all of these have different risk factors. And as I said, even things like diet might have an effect. And so the Fox Foundation just recently has supported a study to better understand the role of tobacco products as well as caffeine and other dietary pieces in Parkinson's, because we think those may be critical pieces of the puzzle. And ultimately, all of this helps inform on our understanding of how we might get to cures.